Question 1. Outline the issues that are typically included in the arrangements section of a health and safety document. Answer. Following the items that are included in the arrangements section of the Health and Safety Policy: Employee Health and Safety Code of Practice, Accident and Illness Reporting and Investigation Procedures, Emergency Procedures, First Aid, Fire Drill Procedure, Procedures for Undertaking Risk Assessments, Control of Exposure to Specific Hazards, Machinery and Electrical Equipment Safety, Maintenance Procedures, Permit to Work Procedures, Use of PPE, Monitoring Procedures including Health and Safety Inspection and Audits, Provision of Welfare Facilities, Training Procedures and Arrangements for Consultation with Employees. Question 2. What are the specific requirements that shall be included in the arrangement section of Health and Safety Policy if applicable? Answer. Following the list of the items that can be included in the arrangement section as a special requirement if applicable: lone working, noise, vibration, hazardous substances, control of contractors, transport risks, waste disposal. Q3. What are the circumstances that warrant the review of health and safety policy of the company? Hence, any one of following change will trigger the review of the health and safety policy: any change in key personnel, management structure, ownership, processes, technology, legislation. Further health and safety policy will be changed if any incident happens, any enforcement action on the company, after findings of the audit, after workers' consultation, and after 1 year automatically must be reviewed. Question 4. Explain why the health and safety policy should be signed by the most senior person in an organization, such as a managing director or chief executive officer. Answer. This will demonstrate management commitment to health and safety policy and give authority to the policy. It also gives authority to the policy. It will indicate where ultimate responsibility lies and the frequency with which the policy statement is a review. It is the responsibility of them to ensure that the health and safety policy is developed and communicated. Question 5. Outline. Explain the general content of the 3 sections of a health and safety policy. Answer. Policy Statement of Intent. It is referred to as the Health and Safety Policy Statement. It should contain the aims and objectives of the organization. It should be signed and dated by the most senior person in the organization, such as Chief Executive Officer, CEO, or the Managing Director. This will demonstrate management commitment to health and safety policy and give authority to the policy. Organization of health and safety. This section of the policy defines roles and responsibility for everyone related to health and safety in the organization. It identifies those health and safety responsibilities and the reporting lines through the management structure. Arrangements for health and safety. It gives details of the specific systems and procedures used to assist in the implementation of the policy statement. Question 6. Identify documents that may be examined when reviewing an organization's health and safety management system. Answer. Documents that are inspected at the time reviewing the HSMS, organization's health and safety policy, documents for evaluation of compliance with legal and organizational requirements, incident data, recommendations and action plans from investigators, absence and sickness records, audit results and implementation records, documents related to communications from enforcing authorities and insurers, inspection, surveys, tours and sampling records, previous review meeting MOMs, documents for internal communications. Question 7. Outline the key elements of a health and safety management system. Answer. Policy is the basic element of health and safety management system, which is prepared and signed by the chief executive of the organization. It is clear statement of commitment to health and safety and shows the goals and objective which an organization need to achieve. Organizing. This element refers to the assignment of the roles and responsibilities for health and safety at all levels in the organization. These are the people who will be actively taking part in the execution of health and safety management system to achieve the goals and objectives set in the policy. Planning and implementing. It is a reference to the detailed arrangements to manage H&S where active and reactive planning is finalized. All those activities are identified which can improve the workplace safety. These activities are selected in line with the goals and objectives of the organization. Documentation, risk assessment, procedures and similar other arrangements 8 put in place to work and implement the planning in each department of the organization. Evaluation refers to the process where the organization will monitor and review its performance periodically, and if finds some weakness in performance it will correct and improve the process of health and safety management system. Evaluation is done by the internal and external audit, and reviews are conducted monthly, quarterly and yearly, followed by an action for improvement. Action for improvement. This stage refers to the action need to take the result of the evaluation and review of the health and safety management system. At this stage weakness and lesson learned in the safety performance are highlighted and improvement actions are designed for continuous improvement. Audit. Audit processes to check the systematically whether health and safety system is working properly or not, whether it is as per plan and schedule. Audit results show the performance and evaluation of the HSMS and enable the organization to review the performance and take further action for improvement. Question 8. Why might the managers of an organization not consider health and safety to be a priority? Answer. The managers of an organization may not consider the health and safety a priority due to the following reasons. Managers are focused to the job progress or production targets, and they do not consider to spend a little time to discuss the safety issues and taking care of the safety. They consider the spending money on health and safety is a waste of money, it does not return any profit, and they are not interested to implement the safety in place. Spending money on safety does not show the profit quickly, so the managers are not prioritizing. Sometimes they do not know the real cost of accidents, so they do not appreciate to spend money to stop the accident. Instead of when an accident happens, they might spend more on them. A manager may be incompetent, and they do not have any information about the legal requirement of the safety, so they do not prioritize. Managers may have very less knowledge about the hazards, and they do not bother to think about safety. Accidents are not happening every day, the managers take it granted, and by the time they become complacent to think about the need for safety. Their targets and objective are usually business-driven and more priority to meet the financial targets, therefore, safety remains in the background, they cannot allocate the budget for safety. Question 9. A company has all the available resources. What are the ways to ensure a good standard of health and safety? Answer. If company have all the resources, then company can easily implement the good health and safety programs to improve the health and safety at workplace. They can start a safety management program that will involve all the stakeholders and energize the human resources to improve the health and safety. Company can start behavior-based safety program that will change the behavior of the safety and lead to workplace safety. They can start the effective safety training program to improve the awareness for the workers, and competence person will work safely. They can start the motivational program and reward program to encourage the workers to participate in safety improvement of the workplace. Workers' involvement and participation in safety decision-making will increase the ownership of safety by the workers. Management can procure new technology and equipment which can enhance the safety for the workers. Question 10. Explain why a health and safety policy may need to be reviewed. Answer. Circumstances that might require a review of policy, technological changes, for example introduction of new plant or processes. 2. Organizational changes, for example changes to key personnel, such as a new CEO or MD, or changes to the management structure of the organization. Legal changes, such as the introduction of new legislation applicable to the organization. Changes to the type of work that the organization does, for example when work arrangements change. Where an audit, investigation or risk assessment suggests the policy is no longer effective. When requested by a third party, such as an insurance company or client. Following enforcement action. Following consultation with the workforce. A change of buildings, workplace or work site. After a certain amount of time has passed since the last review, for example an annual review is a common practice. Question 11. Outline why it is important for an organization to set health and safety targets. Answer. The setting of health and safety targets are important for the following reasons. It is the indication of management commitment to improve health and safety performance. It motivates the workforce with tangible goals resulting in individual or collective rewards. It is useful evidence for monitoring, review and audit purpose and eventually to judge the performance. It keeps the workers and employees focused and they have clear idea what to achieve and where to reach. Question 12. What are typical health and safety targets that an organization may set? Answer. These are some of targets they could consider to set by an organization: a specific reduction in the number of accidents, incidents and work-related ill health cases. A reduction in the level of sickness absence, a specific increase in the number of employees trained in health and safety. An increase in the reporting of minor accidents and near-miss incidents. A specific improvement in health and safety audit scores. The achievement of a nationally recognized health and safety management standards such as ISO 45001. 0 enforcement notices from the enforcement agency. A reduction in the numbers of civil claims. Question 13. Outline why it is important that all persons are aware of their roles and responsibilities for health and safety in an organization. Answer. Following reasons justify that the all person in an organization must be aware of their role and responsibilities. Organizing health and safety requires team efforts from everyone there. Everyone must know his role. People will work collectively, and it will improve collective enthusiasm, skills and efforts. Because of clarity in roles and responsibilities, everybody knows his limit of work and he will try to do it with clarity. It will reduce the chance of accidents and blaming to others. It will improve the behaviors and safety culture of the organization. It will keep the employees focused, they know their limits, they will do the better and safe jobs. Question 14. Two organizations share the same workplace. Outline how they could cooperate to achieve good health and safety standards. Answer. Both of them can take several measures to cooperate with each other for the improvement of health and safety. They shall start an awareness program so that workforce from both organizations should aware of hazards related to both organizations. Both can make one safety committee between them to take care of safety-related issues. They should have common safety programs that can be implemented uniformly in both organizations. They must follow single safety focal point for both, mean they can create a single safety department for both organizations. They can have a common safety monitoring system in reference to performance, accident investigation and risk controls. They can start a common inspection plan. They must cooperate and coordinate in day-to-day activities to reduce the risks to each other from each other's activities. Question 15. Outline the factors that should be considered when assessing the health and safety competence of a contractor. Or outline the factors that shall be considered to assign a contract to a potential contractor. Answer. The following factors shall be considered to decide about the competency of the potential contractor. Previous experience and reputation of the contractors, quality and content of health and safety policy and risk assessments. Level of training and qualifications of staff including health and safety staff. Accident, enforcement statistics. Membership of official bodies related to health and safety. Equipment maintenance records to ensure that those are well maintained and safe for work. Detailed proposals and method statement of work to be undertaken along with safe system of work. Recommendations and references from previous clients. Overall health and safety culture of the contracting company. Resources and arrangements to fulfill their duties with respect to the health and safety plan. Training and qualification of the key role players in regard to health and safety. Previous safe performance accident and incident records. Question 16. Contractors are carrying out a major building project for an organization. Outline how this organization could reduce the risks to contractors before the start of and during the building project. Or, an organization has decided to extend its existing parking lot area. Outline the ways that how the organization can manage the health and safety issues created by this change. Answer. The client organization can control and reduce the risk of accidents by taking the following actions. Initial selection of a competent contractor, ensuring they had sufficient resources and had allowed sufficient time to enable the work to be completed safely. Need to share information with the contractor on the particular risks in the working area, for instance the presence of vehicles including forklift trucks and the danger of falling materials. Sharing the location of hazardous materials such as asbestos and the location of services such as electricity, water and gas. By applying general site safety rules such as a smoking policy and reference to the host employer's safety policy. Coordinating for any requirements for permits to work for certain work activities. By implementing accident reporting and investigating procedures, emergency procedures, informing them of the main contact on site for emergency response. Informing them of the location of welfare facilities including first aid. Whilst the building work was in progress, there would have to be ongoing cooperation and coordination with the contractor, with regular monitoring of performance in ensuring the health and safety of both their and the organization's workers. If the project is at one place, the place of project shall be isolated and segregated from the main workplace. Providing a separated entrance and exit from the specific project work site and providing security controls on the project site. Question 17. Outline the roles of senior management and directors in the health and safety management system. Answer. Directors and senior managers give an organization its direction and set its priorities. They decide what the organization does and how it does it. In effect, they control the corporate body. They are, therefore, responsible for ensuring that all of the legal requirements that rest with the employer are met. They ensure that the right health and safety policy is put in place. They ensure the adequate resources are allocated to establish, implement and maintain the health and safety management system. These resources included the financial and human. They create correct organizational structures with clear roles and responsibilities. They review the progress of health and safety system and ensures it is moving in right direction. Question 18. Outline the role of health and safety specialist in the health and safety management system. Answer. Typical responsibilities of the safety specialist include providing advice and guidance on health and safety standards, promoting a positive health and safety culture, advising management on accident prevention, developing and implementing policy, overseeing the development of adequate risk assessments, identifying training needs, monitoring health and safety performance, overseeing accident reporting and investigations, general guidance and supporting the management in day-to-day activities related to health and safety functions. Question 19. How the directors and senior managers can influence the performance of health and safety management system. Answer. Directors and senior managers are key personnel in any organization, and workers and employees are inspired from them. Their actions means a lot for the employees, therefore they must behave and show themselves as example in front of the employees. Directors and senior managers can have enormous influence over their organization and its priorities. This influence does not simply come from their strategic decision-making but also from the way they are perceived by those lower in the management hierarchy. They must demonstrate clear commitment and leadership with regard to health and safety. Question -20. Why it is important to manage and control the contractor's activities on the client's premises. Answer. Contractors are main part of the workforce of an organization. Their activities will have effect on the functions and health and safety of the organization. Any unsafe working condition or unsafe act may jeopardize the health and safety of the client. It is important to control the activities of the contractor to maintain the safety of the contractor as well as client.